Vegetarians tend to think कि हमको तो कभी heart attack नहीं होगा.
Unhealthy vegetarian diet, healthy non-vegetarian diet से 10 times dangerous है.
Many products today are marketed as healthy. Are these really safe?
They are all poison. Anything that is processed is completely unhealthy for body.
अक्षय कुमार 9 बजे सो जाते हैं.
अक्षय कुमार is very very close friend. अक्षय कुमार तो अगर कभी हार्ट फेलियर होने वाला नहीं है. Always I tell him your heart age is around 25.
जब आप अपने वीआईपी मरीजों का उपचार करते हैं, सांसदों का, विधायकों का, तो क्या आप किसी अतिरिक्त दबाव का अनुभव करते हैं?
तो जब भी कोई भी हार्ट सर्जरी मैं करता हूँ, मैं सोचता हूँ कि पहला बार मैं जिंदगी में सर्जरी कर रहा हूँ.
When you operated on Dr. Manmohan Singh,
He was the best patient that you can think of. He was a diabetic patient. All my diabetic patients, I give example of Dr. Manmohan Singh.
How does drinking alcohol and smoking affect men's and women's heart differently?
Both are equally bad.
vaping,
Hookah, vaping, they're as dangerous. There's a good thing about smoker, those who are smoking. You stop today, most of things you can reverse it.
What is one of the biggest misconception about heart?
Everybody thinks that I'm never going to get a heart problem. The other one is going to get a heart problem. That is the biggest myth. That's why people get into trouble.
So doctors के लिए क्या stress buster होता है?
My operation theatre, I'm operating, always there's a song going on in the background. Without that, I don't operate.
What about those who go to Google?
That is the most dangerous thing because it has killed more people than helped.
Namaste, Jai Hind. You're watching or listening to another edition of the NI podcast with Smita Prakash. Heart disease is the leading cause of death in the world. 50% of heart attack cases since 2020 in India is among adults below 40. India and other Southeast Asian countries have a genetic predisposition to early heart disease, but lifestyle changes have worsened the risk. My guest today is Dr. Ramakanta Panda, cardiac surgeon who has performed over 30,000 heart surgeries. He's considered as the safest cardiac surgeon in the world. Dr. Panda, thank you so much
My pleasure.
for coming on the podcast. I understand I'm stealing you away from your patients at this time, so most grateful that you are here. I want to ask you about why is it that people of the Indian subcontinent are more prone to heart ailments, whether they live now in India or abroad, because many of our viewers are seeing this show from outside the country, but they are of Indian origin or South Asian origin or Indian subcontinent origin. So why is it that we are prone to heart ailments more than people of other places?
I think mostly it is a lifestyle change. And I'm just going back 4-5 decades back when I was in the medical college. We'll hardly see a patient in our hospital who had a coronary artery disease. We used to have valve problems, not these blockage problems that we are talking. Our teachers used to teach us that this is a Western problem, not Indian problem.
Oh, really?
Yeah, in 5 decades it has completely changed. Today we have the highest incidence. There is a lot of thought process going on, probably genetic. Genetic are far less. More it is all related to our lifestyle change. Last 5 years, even within the country and people who have migrated also, if you see the lifestyle is completely changed. There's complete lack of exercise. Our food habits have completely changed. Our Indian food mostly it was based on a organic and natural food. Today everything is processed food and artificial. The sweet content has gone up significantly. So much so in last 100 years our sugar, what used to our great grandparents used to eat in 1 month, we are eating in 1 day. That is the type of sugar consumption gone up. Stress level has gone up, tobacco use has gone up, and lack of sleep and rest. That's again recently emerging as one of the very major factors for getting heart disease.
Okay, that's but it's become a genetic issue. Within 40 years, it becomes.
It's more lifestyle. There's a major study we thought is genetic. It's very less to genetic. Yes, heart disease. There are many risk factors why people get heart disease. It's called risk factor. Genetic is one of them. Not every person with heart disease has genetic cause. That's a very separate thing. In general, Indian population, we look at it, is largely because of lifestyle change.
And young people getting heart attacks, that has become a major cause. That there are videos and things of people just like, just walking and suddenly falling dead. And then people say that ये heart COVID की वजह से था कि क्या था. So why is it that we are hearing more and more that people in their 40s are falling prey to heart
Between
ailments?
20s, I started practice in India in 1993. I'll see below 30 years of age a patient who is once in a year. Today I see every day. 2 weeks back I saw two patients, one 21-year-old boy from Chennai doing engineering third year, got a massive heart attack. A 23-year-old boy from Indore, I had to do his bypass. So it has, in 30 years alone I have seen in my practice, it has drastically changed. Again, everything almost certainly is all related to lifestyle. When I say lifestyle, everything contributes. What happens is the heart disease doesn't occur from only one region. It is multiple factors, and unfortunately, the type of heart disease we are talking about. There are many types of heart disease. There is a valvular heart problem. There is a congenital, you get it at the birth, you get it. Then the heart muscle weakness. They are very different. They constitute around 20%. 80% are blockages in the heart arteries. They are the largest cause of heart problem. That has gone up very significantly, and that is completely dependent on the lifestyle. And these are all related to that.
But our parents never tell us while the child is growing up in the in the teenage years, ऐसे मत करो और वर्जिश करो और exercise करो, ये खाना मत खाओ, वो खाना मत खाओ, इससे heart attack हो जाएगा. Nobody says heart attack हो जाएगा. They just say कि घर का खाना खाओ. Why they don't tell us this, right?
I think there is a lack of knowledge. Now slowly it has emerged, and the only way we can prevent is you have to start very early. These blockages start developing inside your arteries by the time you are in teenage. Almost every room, including myself, if you are not taking care, by the time you are 10, 11 years of age, the cholesterol deposit starts taking place. It might manifest after 30, 40, 50 years. And on the other hand, though to take care of their health properly, this doesn't take place. It is like your kitchen. You don't take care properly, you keep lot of fat and chubby, all those things, you'll find slowly all those कचरा थोड़ा जमता है, एक दिन आपका किचन सिंक बंद हो जाता है. That is a corollary I give. हमारा जो खाना जैसे होता है, आप देखेंगे दो जनरेशन पहले कोई आर्टिफिशियल चीज नहीं था.
हाँ.
खेत में बनता था, उसको लाके हम बनाते थे.
फार्म टू टेबल वाला कॉन्सेप्ट था.
यस. उसमें हार्ट बीमारी नहीं होगा. आपको पता नहीं, जो गाय को कभी हार्ट का बीमारी नहीं होता है क्योंकि वो वेजिटेरियन घास खाते हैं, तो कभी नहीं होता है. द पॉइंट ऑफ टाइम से कि जब तक वेजिटेरियन खाना, अब नॉन वेज ऑल्सो इज नॉट बैड. देयर आर मेनी टाइप्स ऑफ नॉन वेज फूड गुड. विल टॉक डिस्कस लेटर ऑन. As long as you keep everything natural, you will not going to get a heart blockage. The moment you get into artificial, today everything is processed. Processed food, sugar, tobacco, lack of exercise, all these are poison. This is the reason why it is happening. And stress level, and very common for all the youngsters, binge watching a very late night, 1, 2, 3 o'clock watching Netflix and all binge watching. And common thing I find, the moment somebody comes 25, 30 years, two things I ask them. 80% times there are two categories, either IT professionals or finance.
Oh.
Because all night they work, all of them. If you don't smoke, your colleagues or friends are smoking, that's as good as smoking. Because passive smoking as good as active smoking. That boy I was talking about, 21, exactly what you are doing. You are binge watching with your friends at 2:30 in the night, he got a heart attack.
By watching TV?
No, means they
because
have been
continuously.
That is the lifestyle they have been leading for months. And what happens is, again, heart attack means your heart gets blood supply. Heart supplies blood to the whole body. Now, without blood, you cannot survive. And क्योंकि ब्लड में आपका ऑक्सीजन आता है, जो वे खाना खाते हो सब उसको हजम होके उसके ब्लड के अंदर केमिकल होके सारा शरीर में पहुंचता है. तो हार्ट उसके से पहुंच जाता है. तो हार्ट को खुद भी चाहिए खून, उसके लिए उनका 3 आर्टरी है. वो 3 आर्टरी में इफ यू आर नॉट टेकिंग केयर, उसमें धीरे धीरे ब्लॉकेज होता है. एंड विल बी सरप्राइज 50% टाइम्स वो जो बिना ब्लॉकेज में भी हार्ट अटैक होता है, क्योंकि आप प्रॉपर केयर नहीं लेंगे तो आर्टरी फट जाता है. if there is a lot of stress. And this typically is जो youngster late night 2, 3 o'clock, 4 o'clock binge watching, or sometimes when somebody doing an exercise on a treadmill, suddenly they fall down, is usually the artery ruptures there.
Oh.
Yeah, the reason is our inside our body, the blood has to, God has created a fine balance. आपका खून को सारा शरीर में सारा जो आप खाना खा रहे हो सब न्यूट्रिएंट पहुंच रहा है, उसके लिए ब्लड को आपको पतला रहना चाहिए. नाउ सेम टाइम बाई चांस आपको थोड़ा सा चोट कहाँ लग गया तो वो ब्लड निकलेगा तो बंद होना चाहिए. नहीं तो एक बीमारी है हीमोफीलिया जिसमें कि क्लॉटिंग फैक्टर कम है, वो थोड़ा से कट हो गया दे कैन ब्लीड टू डेथ. तो इसलिए भगवान ने दोनों का बैलेंस बनाया कि वो अंदर का खून बाहर निकलेगा तो इमीडिएटली क्लॉट होना चाहिए, बंद होना चाहिए, अंदर वो क्लॉट नहीं होना चाहिए. इसलिए हमारे जो आर्टरी जो बोलते हैं, आर्टरी और वेन बोलते हैं, वेन जो खून दिल के अंदर आता है, आर्टरी दिल से सारा शरीर को जाता है. उसके अंदर एक लेयर है, लुब्रिकेटिंग लेयर. जैसे आप मशीन में लुब्रिकेटिंग करते हैं ना गाड़ी में, तो ऐसे लुब्रिकेटिंग लेयर है, उसको एंडोथेलियम बोलते हैं. दैट इज़ द मोस्ट इम्पोर्टेंट थिंग. वो आपका ब्लड क्लॉट बंद नहीं करता, वो कंटिन्यूसली ब्लड उस पर चिपक जाएगा. तो उस पर समथिंग कॉल्ड केमिकल नाइट्रिक ऑक्साइड. इट्स एज सिंपल एज देयर विल बी मेनी केमिस्ट्री स्टूडेंट्स. इट इज नाइट्रिक ऑक्साइड व्हिच कीप्स अस अलाइव. So nitric oxide, what happens is whenever you take stress and all these activity I tell, it damages the endothelium. So there is no lining is not good. Then the blood becomes sticky and you get a heart attack. And if you don't get a heart attack, what happens is once that area is damaged, the body heals. Like you get a cut, it heals. When it heals, your skin doesn't become exactly same color. It's a different. The same thing inside the artery. The moment this lining gets damaged, it starts healing. When it starts healing, cholesterol starts getting deposited, calcium starts getting deposited, and the cholesterol over time, slowly, that's how the blockage forms. And especially youngsters, elderly people who do 30, 40 years, suppose the blockage are taken to develop, it takes time. So that block, it is very firm, it doesn't break. On the other hand, youngsters, if there is a blockage has formed over a very short period of time, because it is fat, it is. If you see cholesterol exactly like your ghee, it looks yellow, very, very soft, cheesy kind of thing. It's just like cheese. And any stressful condition in the body, even temporary, you get very upset or if you are, as I said, binge watching or not slept for a very long time, what happens is the body stress hormone level goes up, your body your arteries, that endothelium gets weak, so that becomes sticky. There's something sticky substance in the body called platelet. That is a type of cell. That is job is to prevent somebody from dying from bleeding in case there is a cut anywhere. So that also becomes sticky. So all these multiple factors cause the heart attack.
Okay, we'll get to the level of what should one do.
Yes.
When one gets a heart attack or somebody, a loved one around you gets it. Yeah. We'll get to that part. But before that, let me go to the students to ask them, because you mentioned many things that young people do. So let's get on to that. You want to ask a question?
Yes. Hello, sir. My name is Rajesh. And so my question is, many people believe that the heart attacks have increased after COVID pandemic. What are the observations, your observations, and do you agree with this?
Now, not only in India, ICMR and all over the world, people have studied the long-term COVID or COVID vaccine and heart attack. There is no correlation. It has not increased. But during COVID, when somebody has COVID or some of the vaccines when you take, it increases the multiple ways it can cause heart attack. But that period is only when the COVID is there or the inflammatory response is there. Normally it lasts for 2-3, they call long COVID symptom, 2-3 months, during which time your inflammation in the body is very high. That's the only time you get a heart attack. But after that, long term, no studies, nowhere has shown that the COVID is the cause of this sudden surge in heart attacks. It is the only thing, awareness has come up.
And the vaccines did not cause it? Vaccine,
again, there are few vaccines which immediately within 3 months, they used to cause other muscle weakness, especially youngsters, but most of it was reversible. And also in pregnant women, especially those who are on oral contraceptive, they had certain blood clot issues.
Okay.
But those are all temporary, only during the period of vaccination or a very short period. After that, no. Long term, no study, nowhere in the world, including ICMR have conducted a lot of studies, showed that it is not related at all.
Hello, sir. I am Aditya Singh. My question is that, sir, there is a general perception that men have more propensity to have heart diseases than women. So, is it a fact or just a myth? And if it is a myth, so what are some other myths that you would like to burst about heart diseases?
Men have little higher incidence of heart disease than women because women are protected by hormone till menopause. they're slightly protected. But unfortunately, the moment menopause occurs, within few years, there is no difference. And more important, the more myth is, people think the women don't get heart attack. It's the other way around. Women getting heart attack has more complications. Their death rate is much higher. Because a couple of things, it's not universal, all over the world, people look after the men and the household look after, because the mothers and sisters, they look after everybody, nobody looks after them, that is one. Also there has been many studies, there is a bias by the physicians also, not in this country, all over the country, to neglect a woman's health, including heart disease. And on top of that, women's heart arteries are smaller in size, possibly because of lack of exercise. They don't have adequate collaterals, alternate circulation. So a woman getting a heart attack has a much higher chance of having complications and much higher chance of dying. So it is a myth.
It's a myth.
It's a
that
myth, yeah.
Okay, and it's more dangerous. I didn't realize that physicians also tend to say that it's not.
There have been studies showing that physicians, not in India alone, all over the world, even in USA also, there is a bias in less recognizing heart problem in women and treating them properly.
Okay, so let's ask the next question from a woman, please, so that we show that there's no bias here in the room. Yes.
Hello, sir. I'm Jyoti. As you mentioned that binge watching on digital screen affects a lot, whether it be women or men, doesn't matter. Yeah. But since as an adult and about this generation, Gen Z, and also the millennials one, we have this, we have adopted this idea of staying up at late night and sleeping and doing other stuff in the morning. So we also know that body adapts whatever the condition we are living in. So don't you think that or what is it that can our body adapt to this entire scenario?
In the sense कि अगर 8 घंटे if they go to sleep at 2 o'clock and wake up at 10 o'clock, तो they are getting their adequate sleep.
Body will adapt, but it will take you around 50,000 years. I'll give you the story behind it. It will take 50,000 years, not now. Because if you see, we evolved from monkeys, apes to human beings just 200,000 years back. Now, we started doing agriculture 30,000 years back. We started living in communes 30,000 years back. There's no light till 200 years back. So, every human being till 150, 200 years back was eating and sleeping in relation to sun. So, you go to sleep, and before coming this one, and human beings were never on the top of the pecking order. Now we are on the top of pecking order, we are killing all the animals, that's a different thing. But that time we are at the bottom of the pecking order. So the human beings, the only thing was by evening they'll run and climb up a tree, survive all night. And since after that last 30,000 years, everybody used to eat and sleep by 6, 7 o'clock. Your body is used to that now. It will take another, probably the new generation have to work like that for another 50,000 years, then you can do any time. Then your body will get used to it. There is something called circadian rhythm. Your body internal clock is there. So it shuts down after 9, 10 o'clock. And including your now recent knowledge, of course Ayurveda recognized thousands years back, but the modern medicine has recognized the importance of the intestine in last few years only. It is almost like another brain. It also determines your entire health, including your mood, your sleep, etc., etc. There are trillions of bacteria. They also need rest in the night to keep you healthy. So occasional binge watching, no problem. But doing that on a regular basis, you need to be another 40, 50,000 years, then you can do that.
So what about those who who study at night? 5 days a week they're studying till 2 a.m. Maybe not watching TV or not watching OTT, but they're studying till 2 o'clock, or they're doing night shifts for weeks on end. Unka kya hoga? They can't keep to the circadian rhythm.
Yeah, overall it's bad for their health. There are very few people who are circadian rhythms are little different. They're probably 11, 12. There are few people. They can stay awake till, say they can sleep at 12, 1 o'clock. By and large, the whole body has given the biological basis. The best time to sleep is 9 o'clock, maximum 10 o'clock. You should sleep 10 o'clock and sleep 8 hours. Of course, that it could be 7, 8, 9, even 6 hours. Those who get a very, very deep sleep, you can get recovery 6 hours, but very less number of people. By and large, 8 to 8 hours is ideal time. And same 8 hours of sleep, you read all night and sleep at 4 o'clock in the morning is worse than sleeping at 10 o'clock. So unfortunately, it will take, our evolution is only 200,000 years. You need to be another, modern life has to lead like that for another maybe 50,000, 10,000 years before heart disease become less by leading this lifestyle.
And the other thing is that I get it that if you tell your friends that you're going to sleep at 9 o'clock or something like that, you're considered a bore. But 10 years from now, you will be healthier than that friend of yours who was making fun of you.
Absolutely, absolutely, absolutely. There's something nowadays called your heart age. The heart age is like, see, there's two things. One is something called chronological age, means how somebody is 30 years, 40 years, 50. One is physiological age. I'll give you an example. My youngest patient, I call him, I operated, he was 92-year-old. And one of my surgeons brought him just reports. I said, why want to operate somebody 92? He said, sir, just have a look at him. I looked at him, he was not even, didn't look a day older than 60-year-old. So for him, it is 60 years of age. I operated, he's 100 plus, he's still alive. The point, so we have come to now a concept called heart age. Heart means what is your actually age of the heart. Now if you lead a good lifestyle, we'll discuss that. You could be 30, but your heart age could be 15. That means you age whatever average Indian lives, say 70, 80 by the time you guys will be probably, it is going to go up 80. You live 10, 15 years more, that means you will become 100 years. On the other hand, you could be 30, your heart age could be 50 also. Like to those boys.
How do we get to know what is our heart age? What test does one do?
Yeah, there are certain parameters you need to check it out. Your height, weight, blood pressure, cholesterol level, there are multiple parameters are there. You check it out, with that one can check it out. I can ask all of you to do that. Check it out, check out your heart age.
So this is very important, especially when all of you would go for medical insurance. When you do an insurance, what happens is that they do this kind of test to figure out that's how they determine ki precondition hai ki nahi and all. So they get to know what is your premium that you have to pay, and all of you will need health insurance soon. So they get to know what is the kind of premium based on your heart age. Like what Dr. Saab is saying, कि वो test करेंगे to say आप 18 साल के हैं, लेकिन आपका heart age जो है वो 30 साल का है, तो आप कितने साल और जिएंगे उसी हिसाब से. I think Dr. Saab, you can explain this better.
This is exactly like that. Average Indian today it is around 70 years of age. Now if your heart age is already 40 and you are 25, so you will be living 30 more years. So 25 plus 30 will be living for 55 years of age. Insurance also calculates like that. There are multiple parameters to look at it, but the most basic thing you do, lead a very healthy lifestyle, your automatically age will be less.
Okay, that's a
Those
positive
details
note.
we'll talk about it. And I'll ask all of you do that. Occasionally binge watching. If you don't do that, living life is very boring. But that boring should not be every night, every day. Do that once in a while, you can keep that.
Yeah, okay.
नमस्कार सर, मेरा नाम अभिनव है. जब आप अपने वीआईपी मरीजों का उपचार करते हैं, सांसदों का, विधायकों का, तो क्या आप किसी अतिरिक्त दबाव का अनुभव करते हैं, और यदि करते हैं तो उसे किस तरीके से संभालते हैं?
पहले तो अभी 30,000 से ज़्यादा ऑपरेशन हो गया है, तो एक्सपीरियंस हो गया है. लेकिन जब हम ट्रेनिंग ले रहे थे उस टाइम हम भी ऐसे ही हमको सिखा गया था कि बाबा एक बार पेशेंट जो होता है सब पेशेंट सेम रहता है. जब तक कोई पेशेंट को आप वीआईपी सोचोगे तो स्ट्रेस लोगे तो देन आपका गलत चीज़ करने की चांस, गलत मिस्टेक ट्रीटमेंट करने की चांस ज़्यादा है. तो इसीलिए कोई भी वीआईपी पेशेंट होता है पहले मैं सोचता हूँ कि रेगुलर पेशेंट की तरफ है, तो फिर स्ट्रेस की चांस कम रहता है.
सर, जब आप पेशेंट पे ऑपरेट कर रहे हैं and you know that person is a prime minister or a chief minister, which you have done, बाकी जगह भी से तो फ़ोन आता होगा ना, ज़रा उन डॉक्टर पांडा को बोलो कि भाई ये वीआईपी है. आप जानते हैं वीआईपी है, पर फिर भी हॉस्पिटल अथॉरिटी से आता होगा, और फिर भी अदर पीपल मस्ट बी कॉलिंग एंड सेइंग देयर इज सो मच इम्पोर्टेंस फॉर दिस पेशेंट.
यस, ना क्वेश्चन आता है, बट बाय एंड लार्ज इतना इफेक्ट नहीं होता है. 2-3 चीज़ के लिए. एक तो एक्सपीरियंस, नंबर 2 जब मैं ट्रेनिंग लिया था दुनिया में उस ज़माने में, अभी नाउ ऑल्सो इट इज़ द बेस्ट हार्ट सेंटर इन द वर्ल्ड, क्लीवलैंड क्लिनिक. So in those days, every month we'll be operating one head of state or prime minister, president, somebody will be operating. One thing I learned there with me and my mentor, that treat them like a normal patient. Then you are not going to make those decision-making errors.
Okay.
वो एक हुआ, दूसरा again I have operated 30,000. What happens is once you do that, then your surgery becomes a routine. You know exactly how to do. Third thing again I learned in my experience. जब भी कोई भी हार्ट सर्जरी मैं करता हूँ, मैं सोचता हूँ कि पहला बार मैं ज़िंदगी में सर्जरी कर रहा हूँ. कोई भी चीज़ आप पहला बार ज़िंदगी में करते हैं, आप बहुत कशिश रहते हैं, कोई गलती करने की कोशिश नहीं करते हैं. तो दैट्स व्हाट आई डू. वो मेरा प्रिंसिपल है. कोई भी सर्जरी करता हूँ, मैं सोचता हूँ कि पहली बार मैं ज़िंदगी में कर रहा हूँ. देन इतना स्ट्रेस लेवल नहीं रहता है. स्ट्रेस तो कभी का रहता है. विदाउट स्ट्रेस से कि आई डिडंट हैव स्ट्रेस, आई विल बी लाइंग, बट द लेवल इज़ वेरी वेरी लेस.
So, a corollary to what he's saying, nothing about you, but there are doctors who people say that अगर VIP patient है तो ज़्यादा ध्यान देते हैं और जो non-VIP है उस पर ध्यान नहीं देंगे. Especially if somebody is coming from a village or something like that. वो एक तो अपना बता नहीं सकता कि क्या हुआ उसके साथ. And maybe doctors don't pay that much attention. ऐसे होता है.
By and large, I know जितना डॉक्टर हैं, everybody treats their patients equally well. But sometimes there will be always exception to everything in society, in life, everything. That might be some situations, but for me, I treat everybody exactly same. Rather, I treat somebody who is poor little more because I don't want that patient to think that कि मैं गरीब हूँ इसलिए मेरे को care नहीं लेता है. And in our hospital, हमारा ICU में there is no difference. Our ICU rooms are exactly same for the poorest patient or the patient who we do a lot of charity for children. Heart surgery we do free. Whether it is a free patient or the richest patient which has a suite room, our ICU is exactly same. Our operation theatre is exactly same. The only difference is in the room. The room, your 99% of cure is done by the time you go to room. Your operation theatre, ICU is the most critical phase where patient care is most important.
And then the cardiac care unit.
Cardiac. Once you go to room is the recovery phase. There you have suite room, you stay in a very big suite room. Nurses will see you. Other rooms, yes, nurses will still see you. But in terms of care, we don't compromise.
Doc, I'm going to come to the part about insurance. Most Indians don't have health insurance. That's a major thing. And cardiac care without insurance, it can wipe out families.
Absolutely.
How dangerous is this situation today?
It's very bad. अब देखेंगे इंडिया में नहीं दुनिया भर ये जो पर्सनल बैंक्रप्सी, बाकी बैंक्रप्सी अलग, पर्सनल बैंक्रप्सी जो है 40% हेल्थ केयर की वजह से. वो जो 40% है कैटास्ट्रोफिक इलनेस. दो टाइप का आपका बीमारी होता है. एक जो खांसी जुकाम हुआ, ये हुआ, डायरिया हुआ, कुछ हो गया, आप कोई भी जितने गरीब आदमी इधर का अफोर्ड नहीं तो गवर्नमेंट हॉस्पिटल है जाके इलाज कर सकते हैं. जो कैटास्ट्रोफिक इलनेस मतलब किसको कैंसर हो गया, हार्ट अटैक आ गया, किसको नी रिप्लेसमेंट चाहिए, किसको मेजर सर्जरी चाहिए, इसके लिए खर्चा बहुत ज़्यादा होता है. अनफॉर्चुनेटली दुनिया में कोई भी सोसाइटी कैन नॉट अफोर्ड इट. इवन यूएसए में तो बहुत रिचेस्ट टिल वहाँ केयर केम 30% पॉपुलेशन आर नॉट कवर्ड एंड देयर बजट वाज almost $400 billion. So the only way you can do is by getting insurance. Without insurance, nobody can afford catastrophic illness. And all over the world, 40% जो personal bankruptcy ये major illness के वजह से होता है. इसीलिए मैं सबको advise करूँगा, अभी तो at least government of India and every government now has started the insurance for the below poverty line. Or most of the people are covered now. But still I strongly suggest सबको insurance लेने के लिए.
और वो किस एज से पैसे साइड में रखना चाहिए फॉर मेजर इलनेसेस? लाइक शुड अ पर्सन फ्रॉम द एज ऑफ 25 स्टार्ट सेविंग फॉर इलनेसेस और 30 और 40?
मैं बताऊंगा जैसे यू स्टार्ट अर्निंग, स्टार्ट डूइंग, बिकॉज you budget yourself whatever money you want, monthly salary, you budget yourself for your clothes, for your house, for your food, etc. If you have, once you have children, you keep it for the education. So always keep some money for the health. And the biggest money I'll tell you to do, invest in health, we'll talk about it. Please do exercise every day.
Okay.
That is the biggest insurance that you can build in for yourself.
How much exercise? Is it 10,000 steps, 20,000 steps, push-ups? क्या करना चाहिए? Yoga?
दुनिया भर hundreds of scientific study में दिखाया गया है. सबसे एक ही चीज़ आप बताएं कि दवाई या कोई एक ही चीज़ जो सबसे आपका हेल्दी रखेगा इज एक्सरसाइज। ना एक्सरसाइज में जितना भी करो कम करोगे भी वो ठीक है, जीरो एक्सरसाइज से कुछ भी एक्सरसाइज बेहतर है ना। हार्ट और एक्सरसाइज का बेनिफिट है आपका बहुत सारा शरीर को ठीक रखता है, आपका हार्ट डिजीज कम होता है, कैंसर कम होता है, आपका डायबिटीज़ कम होता है, ब्लड प्रेशर कम रहता है, सारा बीमारी शरीर में कम रहता है। जब एक्सरसाइज करेंगे शरीर के अंदर सर्टेन नेचुरल हार्मोन्स होता है, वो मूड एलिवेटिंग हार्मोन्स, दैट विल कीप यू हैप्पी एंड हेल्दी ऑल्सो थ्रू आउट द डे। सो आई विल एडवाइज एवरीवन टू डू एक्सरसाइज। कमी बार कितना एक्सरसाइज करना है, मिनिमम 300 मिनट इन ए वीक करना चाहिए, मतलब 45 to 50 मिनट्स ऑफ ब्रिस्क एक्सरसाइज। बच्चे तो है, तुम जाके खेलो ना, गो एंड प्ले बैडमिंटन, क्रिकेट इज नॉट दैट बट एटलीस्ट डू फुटबॉल, वॉलीबॉल, डू समथिंग, डू सम एक्सरसाइज, नंबर वन। And in terms of amount, as I said, 300 minutes of brisk walk. Then alternate days do weight training. You don't have to do daily weight training unless you want to go for Mr. Universe or something that is different. And these two things are most important. And in addition to that, do yoga. Yoga has two benefits. One is the Hatha Yoga, where do asanas, etc., keeps your all the joints, etc., very supple. And second one will be reducing the stress. So these
breathing exercises,
yes, breathing
and
exercise,
and also
meditation.
for weights and all that. Even if some people may not have the money for weights, but you can do resistance training. And if you just go into YouTube, you can find it कि घर में ही कैसे कर सकते हैं. अगर आपके पास 1 kilo weight नहीं है, तो take 2 bottles of mineral water and you can do it with that. There are ways and means of doing it, even if you don't have to invest in it. Absolutely. You don't have to have yoga mat to do yoga. Absolutely. So there are ways and means of doing it. And
every minute, every hour of your body, try to build in yourself physical activity. Now recently again the new knowledge has come out that sitting for even 1 hour is as bad as smoking. Is that bad for the body? So now so whenever try to do as much as physical activity built into it. Instead of taking a car, just walk 100 meters. In the building, just take an elevator. Climb up the step, don't take elevator. And don't sit more than 1 hour at any place. These are the new studies has come out that even 1 hour sitting in office is as bad as smoking. So now everybody is recommended that you be as active as possible. If you are conducting meetings, stand up and walk around and do meetings like that.
Right. And what about water? Drinking water? People say that is very important and it is not taken as seriously as it is. Hydrating your body.
Yes, and especially in a dry and hot environment, climate like ours. You should drink at least 2.5 to 3 liters of water a day.
Water a day. Okay. Yes, go ahead.
Hello sir, my name is Satyam. As you have mentioned that the consumption of sugar has drastically increased and is really harmful for our heart health. So my question is, like many products today are marketed as healthy. Zero sugar drinks, diet sodas, low fat snacks, sugar free substitutes basically. So from a cardiology perspective, are these really safe or do they pose a hidden risk for our health? Because people usually consume more thinking कि ये तो healthy ही होगा. So what is the effect of that?
You ask me, they're all poison. They're all unhealthy. Everything unhealthy. Anything that is processed is completely unhealthy for body. Now, having said that, occasionally you take is not a problem. Don't make it a habit. So, any processed food is bad for body. Anything that is natural is good for body. So-called these are all marketing gimmicks. All of them are bad. All of them are bad and poison for the body. And the reason is very simple. You have got 3 types of food. One is you have got carbohydrate, you have got fat, and you have got protein. Each of them have to be certain proportion. Now, anything that is come natural, comes from your field, you bring it. Most of them. Let's look at rice. Earlier used to have a brown rice, not white rice. Or Indians are only eating millets. It's only wheat came after the Britishers came to India. So they are very complex carbohydrate. Whenever you eat that, it takes a very long time for you to digest. That's the reason if you eat बाजरा versus regular roti, बाजरा के बाद आपको बहुत देर तक भूख नहीं लगेगा, which is good for you बिकॉज बॉडी के अंदर धीरे धीरे हजम होता है तो शुगर लेवल ऊपर सडनली नहीं जाता है, धीरे धीरे जाता है.
Glycemic index.
ग्लाइसेमिक इंडेक्स. देन ऑन द अदर हैंड जितना प्रोसेस फूड है उनका दीज आर ऑल वेरी सिंपल कार्बोहाइड्रेट. जैसे आप खाएंगे सडनली शुगर लेवल ऊपर जाएगा, जैसे जाएगा उस टाइम आपको ज़रूरत नहीं है बिकॉज यू आर नॉट डूइंग एनीथिंग. सो दैट मच यू आर नॉट यूजिंग इमीडिएटली, सो बॉडी सिक्रेट्स इंसुलिन, तो आपका इमीडिएटली शुगर विल गो डाउन बट इट डजंट गेट कंज्यूम्ड इन द बॉडी. व्हाट हैपेंस, जो चर्बी में बनता है. व्हेन यू डू रिपीट इट लाइक दैट, so your pancreas will slowly start getting fatigue. Like I'll take you run 100 meters, you'll run nicely. If I tell you every 5 minutes run 100 meters, run 100 meters, after 1 hour you will fall down. So this is some of the reason why the diabetes has gone up so much. In last 20 years, the diabetes incidence has gone up double. Today we are the diabetic capital of the world. And diabetes is one disease that can be completely cured by your diet, exercise, lifestyle, etc. Coming back to your point, the so-called diet drinks, etc., they're all poison. There's nothing good about it. Occasionally you have it, no problem. But don't make it a habit, daily habits to do that.
Also, अगर मीठा खाना ही है, what is the best time of the day to eat? You want to eat a slice of cake. What is the best time of the day?
I'll always to eat it in the daytime, never in the night. Anything, another thing, same thing. As I told you, it will take probably another 40,000 years or 20,000 years to do that, because you don't eat any sweets in the night. Because after evening, your body metabolism slows down. You also don't do much of physical activities. So the best time to eat will be in the daytime. I'll prefer in the morning time, at the most lunch, not beyond that.
Okay.
Including fruits also, because fruits has a very high sugar content. So fruits also try to eat in the daytime, don't eat in the night.
We're also heading into the festive season,
Yes.
Doc. So all our festivals, all our happiness is always associated with sugar. मतलब एग्जाम देने जाओ तो चीनी
Yeah.
पहले दही चीनी दे दिया.
Yes.
You're going to travel, पहले दही चीनी दे दिया. किसी के घर जा रहे हैं तो मिठाई का डब्बा लेके जा रहे हैं. It's also the traditions.
Yes.
So how do you change tradition? What do you do? Alternate क्या है?
If you look at it, 40,
नमक
50
नहीं ले
years-
जा
yeah.
सकते, चीनी नहीं ले जा सकते, क्या लेके जाएंगे फिर?
So, if you see, the quantum was not so much even 40 years back. Today it has become, you can see then 20 years how much it has changed. And you cannot, I'll tell you, if you eat, then immediately do some exercise. One of the things that other things, again, these are all recent, last few years research has shown, after every meal, immediately you should do 10 to 15 minutes of exercise. Just brisk walk in the room, in the office or in your study, just instead of sitting on this one, just walk around 10-15 minutes. That increases your metabolism quickly, your sugar level will get control.
Put on your earphones and
Yes.
listen to the Smita Prakash podcast.
Yes, absolutely, absolutely. And walk around little bit for 15 minutes, then you can have 1 or 2 mithai and then run for 40 minutes.
Okay.
That's okay. Youngsters, they can manage that.
So
but
there's
don't
always
eat it
a-
every day.
Silver lining.
Yes.
Yes, go ahead.
Hello, sir. I'm Sakshi. My question is that how does drinking alcohol and smoking affect men's and women's heart differently?
Smoking is one of the most worst risk factors. Now, there's something, before I didn't tell, I'll just tell you, there's something called risk factors. What we have seen is, from millions of patient studies, that if you have any of these, your chances of getting a heart disease is higher. It's called major risk factor. Number 1 is tobacco use or smoking. Number 2 is diabetes, blood pressure, high cholesterol, strong family history, overweight, stress, lack of sleep. These are multiple risk factors. So tobacco and sweets. Tobacco forms one of the most important risk factor that can cause heart disease. The way it does is that nicotine and other substances, they damage the internal lining that, as I told in the beginning, called endothelium, number 1. Number 2, also they make your arteries are very, very hard. So both ways, they increase the blood pressure, damage the artery, that's how you get a heart disease. Alcohol per se directly doesn't affect this type of heart disease we are talking about, the blockage in heart arteries. But alcohol when you take, it increases risk of cancer, liver damages. Also when you take excess alcohol, it can damage the heart muscles. It's called alcoholic cardiomyopathy. So both are equally bad. Smoking, I'll never advise anyone to smoke, and avoid also what is called passive smoking. If your friends are smoking also, you are as good as smoking. Alcohol you can enjoy occasionally is fine, no problem.
And vaping, which is another thing.
Vaping there are dangerous. Hookah, vaping, they're as dangerous.
Okay.
And very commonest, whenever I see a young boy or girl coming with a heart attack, first I send the parents out, then ask them, did you have a vaping? You'll be surprised, most of the time they're either doing vaping or hookah or binge smoking. Very, very common.
So how is it worse for bad or good? Like, what is more for men or women? Women smoking is
equally bad.
Equally bad.
And you have to understand the heart attack occurs because the artery get blocked. The artery can get blocked from cholesterol deposit over 30, 40, 50 years. Somebody is getting heart disease at the age of 55, 60 or 70 years of age. Or the heart artery can suddenly get blocked from because of all these reasons. So don't think that anybody young age also, because young age you will not get a heart attack. You'll be surprised, almost 30% of the people who get heart attack don't have a blockage. Because of all this lifestyle change, they get these heart attacks.
Okay.
Yeah.
What about if women are smoking, say, from the age of 17 till the age of 29, and then they conceive
Stop.
and have a child? They stop, they conceive, they have a child. Does the child have risk of any kind of pulmonary, heart, kidney, anything that could get affected? Because the mother was a smoker?
Ex-smoker, no.
Okay.
If he's not, they have stopped smoking before child has conceived, then the effect on child is very, very less. On the other hand, even in the short period during pregnancy, it will have a serious effect on the child's health, both short-term, long-term. So as long as you stop smoking, and especially the effect of smoking on lungs, within 6 months almost comes back to normal level.
Okay.
So there's a good thing about smoker, those who are smoking, you stop today, most of things you can reverse it, including heart disease also. Heart disease, in my college days when we were studying, we were saying is irreversible. Once it happens, it's a continuous, you cannot reverse it. Today we know that vast majority cases, you can reverse a large extent the heart disease.
But 10 years back, nobody said that diabetes is reversible.
Yes.
In 10 years now, the studies say that diabetes is reversible.
Adult onset diabetes. We
Yeah.
have got two types of diabetes.
Yes.
Children,
Type
that
1,
is
yeah.
type 1, that you cannot, that is congenital. But adult onset, yes, it is completely reversible. It's all lifestyle related.
Okay.
Yes.
We spoke about vegetarian and non-vegetarian food, the diet, because vegetarians tend to think कि हम बड़े ही अच्छे हैं, हमको तो कभी हार्ट अटैक नहीं होगा, हमको कभी क्लॉट्स नहीं होंगे, हमको कुछ नहीं होगा क्योंकि हम वेजिटेरियन हैं. बट इट्स नॉट नेसेसरी ना कि वेजिटेरियन फूड हेल्दी फूड है.
You'll be surprised, 80% मेरा पेशेंट जो वेजिटेरियन है, 20% only non-vegetarian. So ये unhealthy non-vegetarian, vegetarian diet, healthy non-vegetarian diet से 10 times dangerous है. So when you say कि unhealthy vegetarian diet is typically, if you see what our Gujarati Marwadis eat, everything fried, everything has lot of sweets, everything has a lot of salt. These are most dangerous. And anything that's processed food is the most dangerous. When I say healthy vegetarian diet, again going back to our natural. Anything natural food you cook at home, don't put too much oil, ghee, don't put too much salt, that is excellent for the body. Non-vegetarian similarly, anything egg again, there is a lot of controversy. Egg, as long as you do not have heart problem and you do not have a cholesterol level as set are not very high and you are doing regular exercise, leading good habits, daily one egg is not a problem. And you can eat as much egg white, there is a good protein. Then fish especially saltwater fish, because there is some types of algae which has that omega-3 fatty acid, that oil that really protects your heart from heart disease. They are only in fish that eats those algae, and they are usually in salt water. So salt water, especially white fish, they are very, very good for body. So as long as you take egg white fish, chicken breast, and same time you do all other things I said, regular exercise, keep your weight under control, less stress, yoga, sleep 8 hours, then eating non-vegetarian food is as good as eating a vegetarian food.
Okay, interesting. Okay.
हेलो सर, मेरा नाम आयुष है एंड माय क्वेश्चन वाज कि जो न्यूज़ इतनी सारी फ्लो होके आती है हमारे पास कि हमारे एज में हार्ट अटैक इतना बढ़ रहा है, तो थोड़ा सा भी चेस्ट पेन उठता है तो लगता है कि आ गया समय ठीक है, तो दिल्ली जैसे एरियाज में तो इट्स ईजियर कि आप जाओ टेस्ट करा लो प्रॉपर, तो आपको पता चल जाता है कि आपकी हार्ट हेल्थ कैसी है. बट इन रिमोट एरियाज जैसे एरिया से मैं आता हूँ, ऐसे कौन से टेस्ट हैं जो हम करवा सकते हैं जो एक नॉर्मल पैथोलॉजी पे या एक डिस्ट्रिक्ट हॉस्पिटल जो होते हैं गवर्नमेंट हॉस्पिटल्स में, जो आराम से हम लोग करा सकते हैं एंड एटलीस्ट एक वार्निंग मिल सके कि हाँ हमें अब ध्यान ज़्यादा देना चाहिए अपनी हार्ट हेल्थ पर, या हाँ ठीक है अभी तक ठीक चल रहा है, ऐसे चलते रहे तो ठीक है. मतलब ऐसे कोई टेस्ट अगर आप सजेस्ट कर सकें तो.
पहले तो मैं बताऊंगा, जैसे बार बार एम्फेसिस करना यंगस्टर को, वह पहले अपना शरीर का देखभाल करो. जब देखभाल करोगे, क्योंकि जैसे बताया 30% जिसका कोई भी ब्लॉकेज नहीं है बिकॉज ऑफ बैड लाइफस्टाइल यू कैन गेट हार्ट अटैक. तो कोई भी चेक नहीं, इवन इफ यू आर कम्प्लीटली नॉर्मल 30% चांस इफ यू आर नॉट, जो 100% आते हैं हार्ट अटैक में 30 लोगों का ऐसे कुछ भी अंदर नहीं निकलता है बिकॉज ऑफ ऑल बाकी फैक्टर को. वो उसको पहले अपना शरीर का देखभाल करो. नंबर 2 देखो उधर आपका कोई मेजर रिस्क फैक्टर है या नहीं. घर के अंदर सपोज आपका पिताजी माताजी या दादी नाना नानी को हार्ट बीमारी कम उम्र में हुआ था, वो 80-90 साल की उम्र में हुआ तो प्रॉब्लम नहीं होता है, लेकिन 65 साल के कम उम्र में होता है तो बच्चों को उसको 10 साल पहले होने की चांस ज़्यादा है. तो ये है क्या डायबिटीज़, ब्लड प्रेशर, ओवरवेट है, देन यू हैव टू बी केयरफुल, देन चेकअप करना चाहिए. अदरवाइज यू आर लीडिंग एब्सोल्युटली नॉर्मल हेल्दी लाइफ, देन डोंट वरी, यू विल नेवर गेट अ हार्ट अटैक. Now if you have this risk factor, there's certain basic test we do. Now सब लोग जाके ECG पहले करा लेते हैं, सब लोग, और डॉक्टर भी बोलता है, एंड दैट इज द मोस्ट यूजलेस टेस्ट बिकॉज
ECG and echo.
हाँ,
That is like malaria test now.
Absolutely. Both are useless to detect this heart disease. Completely useless. क्योंकि ECG unless आपको हार्ट अटैक ऑलरेडी आ गया है या जिस टाइम आपको अंजाना दर्द हो रहा है, हार्ट अटैक हो रहा है, उसी टाइम किया तो वो ECG में चेंजेस आएगा. आपको अंजाना दर्द हुआ, 5 मिनट का दर्द चला गया, जाके 5 मिनट के बाद ही ECG करो, नॉर्मल आने वाला है. सो प्लेन ECG हैज़ नो मीनिंग. ना इकोकार्डियोग्राम सब लोग जाके पहले कर लेता है. इकोकार्डियोग्राम सबसे बेस्ट है हार्ट पंपिंग देखने के लिए, आपका वाल्व का बीमारी है या नहीं. ये ब्लॉकेज बीमारी के लिए अगेन इकोकार्डियोग्राम यूजलेस, क्योंकि अनलेस आपका ऑलरेडी हार्ट अटैक हुआ है देन उसमें पता चल जाएगा कि आपका हार्ट पंपिंग कम है. तो ये सब टेस्ट कम्प्लीटली यूजलेस है. सो पहले तो बताऊँगा, एक तो अपना शरीर का कोलेस्ट्रॉल वगैरह चेकअप करा लो, स्पेशली आपका रिस्क फैक्टर है, कोई टाइप का रिस्क फैक्टर भी है. नंबर 2 टेस्ट करना है तो इसको स्ट्रेस टेस्ट बोलते हैं. स्ट्रेस टेस्ट मतलब आपको मशीन में चला के आपको दौड़ाएंगे, ट्रेडमिल दौड़ाएंगे, डोंट नो दैट, दौड़ाएंगे. जब दौड़ाएंगे क्या होता है, आपका हार्ट रेट ज़्यादा बढ़ता है. हार्ट रेट बढ़ता है तो इनकेस ब्लॉकेज है तो आपको इस चीज़ में दिखाई देगा. वो भी इतना एक्यूरेट नहीं है, उसमें 20-25% रॉन्ग रिपोर्ट आ सकता है. उसके साथ वी डू स्ट्रेस इको, दैट इज़ वेयर इकोकार्डियोग्राम हेल्प्स. स्ट्रेस टेस्ट का इकोकार्डियोग्राम दोनों मिला के करते हैं, और दे समथिंग कॉल्ड स्ट्रेस थालियम. ये सब टेस्ट पता चल जाएगा. यंगस्टर जिसका स्ट्रॉन्ग फैमिली हिस्ट्री या सस्पेक्ट है, 2 चीज़ मैं एडवाइस करता हूँ. एक तो कोलेस्ट्रॉल चेक कर लो, उसके साथ एक स्ट्रेस इको या स्ट्रेस थालियम करा लो, उसके साथ एक समथिंग का सिटी कैल्शियम स्कोर, वो सिटी कैल्शियम स्कोर कर. ये तीनों टेस्ट किया तो उसमें नॉर्मल है तो चांसेस होने की कम है. उसका मतलब नहीं कि इमीडिएटली जाके मस्ती करो, क्योंकि जैसे बताया 30% चांस बिना कोई ब्लॉकेज में अटैक आ सकता है. ये तीनों टेस्ट सबसे इम्पोर्टेंट है. आपका ब्लड रिपोर्ट करा लीजिए, स्ट्रेस इको, स्ट्रेस थालियम करा लीजिए, एक सिटी कैल्शियम स्कोर. जैसे बताया सिटी कैल्शियम इसलिए इम्पोर्टेंट है, जैसे कोई भी डैमेज हो के कोलेस्ट्रॉल डिपॉजिट बनता है अंदर. कोलेस्ट्रॉल आप एक्सरे करेंगे दिखाई नहीं देगा. यूजुअली क्या होता है, जब भी वो डैमेज होता है, कोई अंदर कोई डैमेज हो जाता है, जब वो घाव सूखता है अंदर, कोलेस्ट्रॉल के साथ कैल्शियम डिपॉजिट होता है. सो कैल्शियम डिपॉजिट ज़्यादा होगा मतलब इनडायरेक्टली पता चलेगा उस पर कोलेस्ट्रॉल डिपॉजिट है, ब्लॉकेज हो सकता है.
Okay.
So
that is if you're in that category where
Yes.
you have family history. Otherwise, some simple things is like just climb up 4 flights of stairs.
Exactly.
If you're getting breathless, or if you are walking for about half an hour in brisk pace or 20 minutes brisk pace, and you're perspiring too much or getting breathless, then you see that there are some warning signs which are coming your way.
Many people who are especially not fit, and if suppose worked all night and next morning is you listen to your podcast, suddenly start doing exercise, you are going to get breathless. So first and foremost, you have to give adequate rest to your body and then do everything.
Yeah. Absolutely true.
Yeah.
Whenever I reach the gym, the first thing that the instructor asks कि आप ठीक से सोए थे कि नहीं रात को?
Very, very important.
So if I say नहीं सोई थी, then I'm only doing resistance training.
Absolutely.
No cardio.
Absolutely.
That I'm doing
Absolutely,
after that.
absolutely.
If I have not slept well.
Yes, yes.
That is important. It's not that I don't exercise then, but then I'm doing strength training
So
and
other thing,
resistance.
absolutely.
No cardio.
Yes.
If you're doing that.
Yeah. And quite often you hear the sudden death also partly related to that.
To that, yeah. Especially these, you have film actors also who come to you.
Yeah.
So one is hearing about those film actors also that, suddenly wo gym kar rahe the and they got a heart attack and all that. Why is it happening to celebrities? What happens to them?
Now it is very common. Not a celebrity youngsters. Just now, only I was coming on the flight. One of my friend, he retired as the deputy governor of the Reserve Bank. He's a bank chairman. He was just coming. He said, I just went for my bank's CFO's funeral. He was only 35. He just arrested on exercise, died. So it is getting very common. Multiple reasons. Number one, those who have this one thing, you don't get enough rest. Then because exercise, you think that suppose you have not slept for 8 hours or 4 hours, you try to make up with exercise. You cannot make up with exercise. And that's a more dangerous period because if you are not given adequate rest to the body, inside the body your stress hormone levels are very high. That's the wrong time to do exercise. That they do. Second thing, people push at the last moment. अब marathon में देखेंगे जो heart attack होता है, we always call it last 1 mile. We are partner in Mumbai marathon for 20 years, and almost always last 1 or 2 mile the heart attack occurs is all over the world because people push against that limit in the last 1-2 mile marathon, try to make up little time. So many times in the gym also people push beyond it. I remember many years back I had operated one patient, youngster, his son was very obese. So he said, sir, I'll start doing exercise. A month later I got a call from his father that he got a heart attack. We are airlifting. We airlifted him. Did an angiogram, his artery had ruptured. Nothing. When we found out what he had done, is first time he went for exercise and he started spinning at the high speed. So what happens is, one I said, if you are not getting enough rest, don't exercise. Don't push yourself against the limit. Many times people suddenly want to run, they have been running say 6-7 kilometers, suddenly they want to do 14 kilometers or 12 kilometers for a long time. So don't stress yourself against that. Third thing also, sometimes you can have hidden defects in the heart. There are two types of disease. One is heart muscle weakness, I talked about, cardiomyopathy. It can be completely asymptomatic. And when you are doing a lot of exercise, especially if you have not slept properly, the heart suddenly can stop. It's very, very common. And fourth thing is, you find quite often very healthy athletes, especially I have seen this World Cup, etc., those footballers suddenly died or arrested because there is certain abnormal origin of the heart arteries. This is a congenital defect. I know one of my very close friends' daughter had that. We manage medical without surgery. Sometimes you need to do surgery to correct it. She is now almost 34, she is doing fine. And what happens is the heart arteries that comes out, it sometimes comes out in an abnormal location. Or it comes out between the two main arteries, those are science students, between the aorta and pulmonary artery. When anybody does exercise, both the arteries dilate. When they dilate, these arteries, they get compressed.
Okay.
So these are mainly 4 reasons why people suddenly die on the, and fifth one is sometimes because of the stressful condition, people may not have any, that cholesterol deposit suddenly ruptures. And the chances of sudden death, all these things you will find is much more in youngsters, not in people who are 40 or 55 or 60. Because the longer you are done, the cholesterol deposit when it starts, it is firm. It is not anymore soft. Youngster, the cholesterol deposit is very, very soft. So at the height of exercise, it can just rupture like a popcorn. If you rupture, the artery will get blocked. You can get heart attack.
You see so many important people, celebrities and all that. And 2 celebrities who I interviewed who are very physically fit lead very boring lives, they tell me. Sunil Shetty and Akshay Kumar. They are both like, one of the people was saying, 9 baje so jate hain, they wake up in the morning and their friends tease them, they break their doors down, party pe chalo, they will not do it. They wake up with the sunlight, and could be 4:30 or 5 in the morning, and they eat typical food, which is like ghar ka khana.
Yes.
And they do that, and they lead very boring lives, but they are both very fit. You know them, right?
Akshay was a very, very close friend. His birthday was only 2 days back. And no matter what, come hell and rain, anything, he will go to sleep by 9 o'clock. He'll get up at 4, he'll do exercise, nothing will stop it. That doesn't mean that I'll tell all of you do that, but at least try to lead a routine life as normal as possible, do as much as exercise. Akshay Kumar is absolutely normal, I mean, phenomenally disciplined life.
Yeah.
Yeah. And you do that, you'll never get a heart problem.
So, so once there was a breakfast meeting that I had with him, and तो breakfast था तो I asked for avocado toast, and he just looked at me and said, "क्या गंद खा रही है?" And he got a nice, chapati made of bajra or one of those.
Yeah, and you must have got a huge patiala peg, this one, this big
lassi
juice.
and juice or whatever he was drinking, but he had natural food, which is probably come straight, healthy food. And I said, but whatever. He says, now whole day I will survive on this because I've eaten well. अब मैं interview करूँगा, काम करूँगा, everything. So, but his breakfast is an important thing. Most of us don't have time for breakfast.
Yes.
Is breakfast important?
Both ways are important. I'll tell you this, I'll put the other way around. Till 100 years back, or max 200 years back, all over the world, average human being was eating only one meal a day. We don't need more than that food. It is only last 100, 200 years that the meals have come, more than 2 meals. And that's why the diabetes, etc. has started coming. In terms of food need, you don't need one younger age and after you reach certain age, your calorie requirement goes down drastically. And you don't need 3 meals a day. You decide which 2 meals or 1 meal or 3 meals you want to eat.
Oh God.
What is important is the evening meal has to be as early as possible because body is still used to at 6, 7 o'clock. It is used to sunset, sunrise. So the last meal has to be maximum 6, 7 o'clock. That's the healthiest.
So eat in the morning like a king and by night eat like a pauper.
Or don't eat at all.
Don't eat at all.
For example, today I had my lunch, we had a medical meeting and that's it. This is my tea and that's it.
You don't need more nourishment than that. ये वो ओडिया जीन्स होगा फिर because Gujaratis and Punjabis need to eat.
Yeah. Now, while growing up, you need all proteins, everything. It's very, very important. What I said is not for everybody. Well, all youngsters, while growing up, you need to have both carbohydrate, fat and protein, everything to build up. If you see the earlier generation, current generation, everybody is growing up 6 inches, 8 inches taller. So it's very important for you to have everything. You need to have 3 meals or 4 meals. My son, when he was growing up, he became 6'3". Between the age of 14 to 17, you will find his head inside the fridge all the time.
But sir, thin people tend to think that they are very healthy. Thin people also can get heart attacks.
Oh, absolutely. Thinness has nothing to do with whether you not get heart attack. It's the lifestyle you lead, the type of food you eat, and other factors. So coming back to our food thing, for youngsters, you have 3 meals, have a balanced diet, occasionally go do the binge food, whatever. I call it Sunday, you keep it as a sin day, 6 days you keep good. So 6 days eat nice, do everything, 1 day you can enjoy. And once you reach 40, 45, what happens is then your muscles start getting less and less. That's why if you see the same person at the age of 20, 25 can eat 4 or 5 chapati and so much rice, nothing happens. At the age of 45, 50, 2 chapati, put on weight.
Yeah.
So once you do that,
my age, even if I smell it, I put on weight.
Yes.
So
you won't believe, there's time in my college days I was only 47 kilo. Now I'm 67. So you don't need to, number one, your calorie requirement goes down drastically, but very important that you have to have a very balanced diet. You should have a good, high quality carbohydrate, high quality protein, and same time, all other nutrients that is very important for your body. Okay. So average for anybody after 42 meals is more than adequate.
Okay.
While growing up, all youngsters, please eat whatever you want to. As long as healthy eating, please do that. And do regular exercise and do gymming, weight training every alternate days.
जी आप पूछिए।
नमस्ते सर, मेरा नाम अभिनव कुमार है और मैं सर आपसे पूछना चाहता हूं कि जब कोई व्यक्ति गांव से शहर आता है और किसी मेट्रोपॉलिटन सिटी में आकर के जीवन यापन करता है तो क्या हृदयघात की संभावनाएं बढ़ जाती है? अगर बढ़ती है तो ऐसी कौन सी सावधानियां हैं जो हमें बरतनी चाहिए?
ये सब लाइफस्टाइल की वजह से हो रहा है। अब देखोगे तो अभी ऐसे में स्टडी हुआ था, अभी पहले 30-40 साल पहले गाँव में हार्ट का बीमारी कम था। अभी धीरे धीरे बढ़ रहा है। कोलेस्ट्रॉल लेवल कम था, हार्ट बीमारी कम था, अभी गांव में भी हार्ट बीमारी बढ़ रहा है, कोलेस्ट्रॉल भी बढ़ रहा है। मतलब अर्बनाइजेशन उल्टा जब जाता है उधर भी हो रहा है, और उधर से गांव से जो आता है उनका भी वही प्रॉब्लम है। तो वंस यू कम टू अर्बन लाइफ, सेम थिंग, आपका जो हार्ट डिजीज़ का रिस्क बढ़ जाता है, क्योंकि लाइफस्टाइल चेंज होता है, फूड हैबिट चेंज हो जाता है। गाँव में देखेंगे तो द रीजन आजकल ज़्यादा हार्ट का बीमारी बढ़ रहा है, क्योंकि लाइफस्टाइल चेंज हो गया। फूड उधर भी आपका पिज़्ज़ा, बर्गर ये सब मिलता है, घर में वो ज़्यादा चलता है रादर देन नेचुरल। पहले 20 साल पहले खेती से बना के उसको खाते थे, उसमें कोई ख़राब चीज़ था, सब नेचुरल था, हार्ट बीमारी होने वाला नहीं था। द मोमेंट यू गो टू अर्बन लाइफ, सारा चीज़ चेंज होता है, खाना चेंज होता है, स्ट्रेस लेवल चेंज हो जाता है, आपका एक्सरसाइज कम हो जाता है, सोने का टाइम ठिकाना नहीं रहता है, तो ऑटोमेटिकली ऑल दिस फैक्टर कॉजेस। तो अर्बन लाइफ इज नॉट बैड। अशोक कुमार, अक्षय कुमार तो अगर कभी हार्ट बीमारी होने वाला नहीं है। हिज हार्ट एज विल बी लाइक 25 years. Always I tell him, your heart age is around 25.
But what about when you operated on Dr. Manmohan Singh? After that, when you told him, because post surgery also the care is important. So was he listening to you? Did he do?
No, he was a fantastic patient. He was one of the most, the best patient that you can think of.
He did everything that you told him to?
Yeah, yeah. And if you see, he was diabetic. I always, all my diabetic patients, I give example of Dr. Manmohan Singh. And he lived for 16 years, no heart problem. His sugar was always controlled. He was a diabetic patient, but his sugar, HbA, once you check it out, never ever more than 6.5. He was such a good patient.
Also, family's support is very important.
Yes.
I mean, the wife who cooks the food, or the mother, or whatever, whoever is in the house who's in charge of the kitchen, should ensure that mindful खाना बनाना चाहिए. और अगर there is a tendency towards diabetes, then and heart related issues, then the diet, whoever is controlling the family diet, that person should be mindful.
इसमें मेरा कोई पेशेंट काउंसलिंग मेरा आधा टाइम फैमिली के ऊपर जाता है. तो एवरी पेशेंट, हार्ट पेशेंट, आई फोकस मोर ऑन द फैमिली एंड लेस ऑन द पेशेंट, because it is an environment and everything has to be modified. Without that, the heart बीमारी, only the patient, if you focus on just giving medicine, is not going to make any changes. Okay. So because I remember many years back in our my high school, Rabindranath Tagore, there is a very famous line, one short story he had written. He said, if the costly medicine could save lives, why should kings and emperors die? The point is, you need to keep yourself healthy. So medicine is not going to make that much difference. So that's why, coming back to this, it's very, very important to counsel the family, see that the entire family leads a heart healthy life. Then not only the person who got a heart problem, everybody has to lead that.
You were saying alcohol नहीं पीना चाहिए, but थोड़ा सा पार्टी के टाइम पीने के लिए वाइन होना चाहिए, विस्की. What is more dangerous? Don't laugh, bhai. I don't drink alcohol. मैं सिर्फ आप लोगों के लिए पूछ रही हूँ.
Yes. See, number one is alcohol is not good for health, but occasionally enjoying alcohol is fine as long as 1 or 2 packs, not more than that. It's not be every day. Like one of my patients jokingly said, his liver was so bad before operation, we checked out. I said, पिता नहीं साहब, कभी कल थोड़ा पी लेता है. उसको wife was standing behind, she was like, sir. so as long as not a bottle a day is fine. So occasionally, again, daily drink is not good for health, is not good for liver, increases the risk of cancer. Heart blockage, it doesn't cause problem, but it can damage your heart muscles.
Okay.
So occasionally drinking is not a problem.
Okay, emotional stress. That also one question.
How much does emotional stress lead to a unhealthy heart? Number one. And number two, we usually eat ghee and drink coffee on a daily basis, thinking it's healthy. But does it really healthy, and how much does it affect your heart?
I'll answer the second one, is smaller one, easy to answer. Ghee, as long as it's natural ghee made in home, cultured ghee, you make it from dahi and that is healthy. As long as 5 to 10 ml per day is fine. Coffee, again, 1 or 2 cups is all right. It's good for body, good for liver. Doesn't make that much difference to heart, but it's fine. Beyond that, anything excess is bad. And now, emotional stress. You see, it is linked to our evolution for human beings. Now, when you, from human beings, as I told you, we are staying in jungle for 170,000 years. So there is something called fight or flight response, because human beings are never the top of pecking order. We are on the bottom. Either your big herbivore will come and kill you, भैंस आके मार देगा, नहीं तो उधर आपका शेर आके खा जाएगा. So human beings are all the time running around how to save themselves. So there is something called fight or flight response. शरीर के अंदर that response is there. What it does basically is increases your hormone, stress hormone level. उसका दो ही काम है. आपका हार्ट रेट बढ़ाएगा, तो आप हार्ट ज़्यादा काम करेगा तो आप ज़्यादा खून पहुँचाएगा. आपका जो मसल में ज़्यादा खून जाएगा, बाकी जगह सब कंस्ट्रिक्ट कर देगा. ब्रेन का आर्टरी ब्लड सप्लाई कम हो जाएगा, बाकी हो जाएगा. सो दैट आप भाग के पेट के ऊपर चढ़ जाओ, नहीं तो उसके झगड़ा करके सब अपने बचाओ. ना मॉडर्न लाइफ स्टाइल दैट इज नॉट देयर. लेकिन द मोमेंट यू टेक स्ट्रेस, बॉडी डजंट थिंक दैट यू आर टेकिंग स्ट्रेस. Body still is in that boat. It will take another 50,000 years to come out of that jungle. Body still thinks there is a tiger is coming to kill you, or there is a voice is coming to kill you. So the hormone levels start increasing inside the body. It's called fight and flight response. It is still there inside the body. So getting stress occasionally, see, life is full of stress. Getting occasional stress is not a big deal. Nothing will happen. When you have a continuous level of stress, your stress hormone level stays very high inside the body. What it does is increases the heart rate all the time, makes your arteries very, all the time it is constricts the artery, because it still thinks that you need to supply more blood to the muscles and less to the brain. And over a long time, the arteries start getting damaged, you start getting blockages, get hypertension, all the other associated diseases start occurring. So that's the reason stress continuous for a long time is bad for body. One of the best way to do is our Indian yoga. Yoga is one of the best ways to reduce your stress. I'm a very, very firm believer. Every day I do yoga. So I'll advise everybody, whenever you get time, if 5-10 minutes, you can do your yoga.
Okay. Let me come to the part when अगर heart attack हो गया, like youngsters के लिए CPR, to learn CPR, at what stage should it, should the policy makers of this country decide that school level पे, college level पे कब सिखाना चाहिए CPR?
My opinion, school level में सिखाना चाहिए. USA, American Heart Association, and the government has taken, they have trained everybody. I very, very, very strongly I'll advise, because heart बंद हो गया तो within 3 minutes you can resuscitate. After 3 minutes brain gets damaged, you cannot do that. I'll very strongly, I wish the government does at the school level train everybody. It's a very, very easy way to do that.
So educators who are listening in to this show, please don't wait till the government tells you. Start this process of training. We've done that in our office. We got people to learn how to do CPR, and we have saved people.
Oh yes, absolutely, absolutely. We have got so many in our Bandakula complex where we're located. We regularly send our doctors. They regularly conduct CPR training courses for everybody, and we have saved so many people.
Okay, for curative purposes, to go to hospitals is extremely expensive, and like he was saying that in villages. So what would your advice be to governments? How can we improve the cardiac health of our population? More hospitals or more universities where they are teaching cardiac care? What should be done?
I think the most important is, I'll tell you, no society in the world has been able to sustain disease care.
Okay.
When I say disease care, I mean you develop the disease and then try to treat. No society, nobody, no country is able to do, because disease care is terribly, terribly expensive. So now focus should be maximum now on
prevention,
healthcare.
Healthcare.
Managing your health is more important than managing the disease. Focus should be there. Having said that, absolutely, number one, as I said, insurance has to be there. Number two, I think as much as possible, starting from school, college, every level, we should educate people as much as possible for health management rather than disease management. I give you one example. 1997 to 2006, 10 years, USA, the American Heart Association, the press, the public, everybody took a lot of effort. They brought down the heart disease by 26%. Of course, again, everything has gone backwards. People again have become obese and not less doing that. The point you are trying to do, that is a concerted effort by the government and the public and media, everybody. We can drastically bring down the disease burden. Very, very important that everyone has to learn that health management is much more important than disease management.
And also, you know, it's like you hear Europe में cheese, milk वगैरह खाते हैं, लेकिन वहाँ पे health, वहाँ पे cardiac issues इतना नहीं होता. अमेरिका में cardiac issues ज़्यादा है. India में who are more prone to cardiac, you know, is it north, south, east, west, which parts?
If you see, Americans are very health conscious. They do a lot of exercise. Europeans do a lot of exercise. Also, there is certain genetic. If you see, their muscle mass is much bigger than ours. We have got a much less muscle mass.
Yes.
Our food habit, if you see, our carbohydrate content is very high. So we have got a huge stomach. That is very bad for the health angle. So, having said that, in India, our disease, if you see, there is a higher incidence, more especially in the Gujarat, Rajasthan, that again is related to the type of food. I don't think anything to do with genetic. It is more related to that because they eat lot of unsaturated fat, lot of sweet, sugar, everything fried, everything processed food. Again, the lesser incidence you will find on the coastal belt where people are more, they eat a lot of fish, and also the food doesn't contain so much saturated fat and fried sweets, etc.
Okay. Any other questions? Okay, Hanji.
Hello, sir. Hello, ma'am. My name is Kashish. And my question is pretty simple, sir. What is one of the biggest misconception about heart you would like to burst here?
Any myth?
That everybody thinks that I'm never going to get a heart problem. The other one is going to get a heart problem. That is the biggest myth. That's why people get into trouble.
They think there are many people who say that he was such a happy person. He was कोई stress नहीं था, सारा time smile करता था. उसको कैसे हो गया? इतना पतला है, उसको कैसे हो गया?
Unfortunately, yes, because the person itna smile karta, you don't know how much stress he must be taking inside, or genuinely you are smiling or taking stress, whether he has any other risk factors. And quite often, as I said, there are a lot of these congenital heart defects that people don't realize, suddenly they get into problem.
And also don't ignore your mothers and sisters.
Yes.
Those who, you know, who you think are taking care of everybody.
Everybody,
Many
yes.
of them are taking all that inside and internalizing
yes.
the stress.
That's why, especially in Indian society, you know, we neglect our mothers and sisters, their health. And that's how the heart disease is quite often underdiagnosed, or if they have, we always say no.
Also, there's resistance, doctor, to take mothers. They don't agree to go to the doctor.
Yes, yes.
The first thing is कि अरे डॉक्टर के पास जाएंगे तो टेस्ट करवाएंगे.
कुछ निकल जाएगा तो क्या
कुछ निकल जाएगा तो क्या करेंगे? That is there. Anybody else? Okay.
Hello, sir. Myself Hema Vishwakarma. I have a question apart from health issues. Actually, my sister is doing graduation in OT technician, and she is now doing a clinical posting as a OT technician. But whenever she is interacting with surgeons, so every surgeon is like कि मतलब like तुमने चूज़ क्यों किया ये कोर्स को, तुम्हें नर्सिंग करना चाहिए, कैसे ये मशीन्स को तुम इधर से उधर करोगे. So is it, as you are a surgeon, so is it really so कि why there is so much gender biasness?
OT technicians are usually men. Women are not encouraged to become OT technicians.
I'll give my OT, everybody is woman.
But
So I don't think there is gender bias there.
But जब भी वो इंटरेक्ट करते हैं उसे हमेशा डिमोटिवेट ही किया जा रहा है वहाँ पर.
So it could be individual bias. By and large, if you look at me in our hospital, all the OT technicians are women.
Okay.
Yeah.
So maybe she needs to move to a nicer place then.
Every profession is good. I don't think any profession there is any gender bias should be there.
So doctors के लिए क्या stress buster होता है? क्योंकि tension कितना होता होगा ना, that you
Yes.
have patients who come and you're at the OT table and their entire life is in your hands. So how do you all manage stress?
Doctors are just like human beings, just like you. We have a same level of stress, everything you take. The thing is lead a balanced life. What I do, I always advise everybody that your profession is not the only thing in your life. You have a family, you have got friends, you have got society, you have got hobbies. Always I advise everybody do some hobbies. I have got a hobby, I do a lot of wildlife photography. Second thing, I listen to music. So my operation theatre, while I'm operating, always there's a song going on in the background. Without that, I don't operate.
Oh,
So
okay.
there are many ways you can reduce your stress.
Yeah.
Yeah. So I'll advise always everybody, and that don't let your profession or your study consume everything. Also keep some little bit time to smell the roses. So relaxation, time with friends, and not binge watching at 2 in the night. Occasionally once in a month you can do, not on regular basis. So have a hobby, do something that keeps you happy.
Okay. Yes, go ahead.
Hi sir, I'm Kalpana. I read a book a while ago by the name that our body keeps a score, meaning that our body stores emotions, and sometimes we feel bad emotions, so that turns into psychosomatic diseases. So what kind of emotions actually get stored in our heart, which can or which causes heart diseases, and number two, how can we overcome that? And my another question is, I saw a documentary called Blue Zone documentary. So the gist of it was that the purple colored food are for our nervous system, red color food are good for our heart. So is it true?
I'll ask the second one.
Jalebi is also red color, no?
So jalebi is also red color. So natural, that's not natural.
Carrots,
so,
okay.
Yes, any colored fruits usually has lot of antioxidants, very good for the body. Whether it's for heart, not only for heart, it's for overall even reducing cancer, because there's something called antioxidant. The body produces all the time toxins in the body that needs to be cleaned up from the body. So a lot of colored fruits are very good because they are very, very high in antioxidant. The alcohol, your wine came from there. That's the reason somebody asked, should I take a red wine every day? I said, instead of red wine, eat red grapes. So that is as good as red wine. So this is called antioxidant coming out of fruits. Now in terms of the stress, this is again, it is all mediated to the stress pathway I explained to you. That's why it causes the heart disease. Yeah.
Okay. Doc, there's another thing which I've heard is घर में sorbitrate रखना चाहिए. Is it true?
If there is no incidence of heart problem where everybody is healthy, I don't see any indications of keeping
And how do you
sorbitrate.
figure out कि ये gas है कि heart attack है और sorbitrate movement who's there?
Yes, that's a very common thing. Unfortunately, heart, that's a very important question you asked. The commonest symptoms of heart disease is you get a very heaviness as if some stone is kept on your chest, is pressing your chest. Unfortunately, almost 30% patients, you don't get that symptoms. You get what is called atypical symptoms or no symptoms at all. Atypical means you might getting a jaw pain. We have got patients who have gone to dentist and got a heart attack after a few days. People have gone to gastroenterology. Recently, actually, one of the very famous Telugu actor, I had operated him, and his daughter went for 6 months to gastroenterology, suddenly she dropped dead. That was in the news. This is called atypical pain or referred pain. One has to be a little careful. As long as you do not have any risk factor in the family and you yourself don't have any risk factor, don't have to worry if you are having acidity or chest burn or jaw pain, it is not. But on the other hand, if you have, of course, any risk factors, and especially youngster now, especially if you are doing any of these binge things that I said, the two boys, one I operated and one was we managed without anything because the artery we opened up with a stent. They had no other problem. So because they are doing very binge watching, that's why they got into trouble.
Oh my God.
Yeah.
Just binge watching resulted in...
Binge watching with cigarette and so when binge watching doesn't happen only that.
Yeah.
It happens cigarette, it happens with your pizzas, burger, all those things. Everything starts with that whole ecosystem. When that happens, then you have to be careful. Other than that, all the things I said, if you are doing all of them, you are not going to get a heart problem unless you have a very strong family history or something.
What about pediatric cardiac issues? Like you hearing about 10-year-olds, 11-year-olds getting heart attacks. How is
There's a very different type of heart attack. That's not related to this blockage type of heart attack. That different type of, they're born with heart defects. So they get into heart attack. Somebody's arteries are coming on the wrong location, heart muscles are weak. These are different type of heart attack.
So those 8-10-year-olds is not because they were obese, because the headline says that.
Not related to this type of heart. That's a different type of heart disease.
All right.
Having said that, the youngest one I have done, I have operated one 16-year-old girl Unfortunately, she had a very strong familial history. Her triglyceride level was 1400, cholesterol level was around 800. So that was a very different situation. So there is no need for sorbitrate. But if there is a high risk in the family, the best thing I'll suggest is immediately consult your doctor rather than self-treating yourself.
And what about those who go to Google and AI?
That is the most dangerous thing because it has killed more people than helped anybody. And the reason is quite often your acidity and the heart attack symptoms will similar. You have got acidity, you take aspirin, then you are going to get a massive bleeding from the stomach.
Oh.
And until few years back, we used to recommend, because one of the commonest best medicine to when somebody gets a heart attack, we give aspirin. So much so, there was a lot of thought process going on among doctors that we give aspirin to everybody above 50. Then we realized when they started doing, more people died from complication of aspirin than from having a heart problem. So now the recommendation is don't give aspirin to anybody unless the person has a heart problem. So many times people advise keep an aspirin, you can have a certainly suspect a chest pain, you take it, but it could be acidity also. The best way is consult the doctor and then whatever the doctor advice, take it. Don't self-medicate.
Okay.
Because today doctors is available 1 minute away from a phone call.
Right.
हेलो सर, माय नेम इज़ राहुल कुमार। सर जैसे अगर हम लोग कभी जिम जाते हैं तो जिम ट्रेनर हमें सजेस्ट करते हैं कि अपने डाइट बैलेंस के लिए प्रोटीन कंज्यूम करना स्टार्ट कर दीजिए, तो वो हमारे हेल्थ के लिए या हमारे हार्ट के लिए वो कितना सही है? क्या हमें वो कंज्यूम करना चाहिए, हमें उससे दूर रहना चाहिए?
आई वेरी स्ट्रांगली मैं एडवाइस करूँगा कि आप नेचुरल प्रोटीन खाइए, डोंट टेक एनी ऑफ दिस प्रोसेस्ड प्रोटीन। नेचुरल प्रोटीन सब वेजिटेरियन है तो आपका ये है पनीर है, टोफू है, सो मेनी डिफरेंट टाइप्स ऑफ डिफरेंट वेजिटेरियन प्रोटीन है। नॉन वेजिटेरियन है तो एग वाइट है, मच्छी है, चिकन है, वो लीजिए। Try to avoid processed this.
पनीर मतलब पनीर पकोड़े नहीं लेना।
हाँ, पनीर पकोड़ा नहीं। Yes. So उसके साथ घी आ जाता है, तेल आ जाता है. So take natural protein rather than any of this processed protein.
Okay. So any last message that you have before we complete the show? Anything that you would advise when a person feels that they have a heart issue? Of course, rush to the doctor. But is it something to fear that most of us will get it? What should we look out for?
In today's time, my first advice will be don't worry at all about heart disease. Even if you get it, today it is almost curable. When I studied medicine, we thought heart disease was considered worse than cancer even. From there, today we have come to a stage, anybody has heart problem can still live a completely normal life. You don't have to worry at all. That in case you get a heart disease, your life is gone. You can absolutely lead a normal life, both quality of life and length of life. And more important than that, please do all the things that I suggest, I advise to keep yourself healthy so that you don't get a heart problem and your family members also don't get that.
Are you happy that you chose this line, doctor? Would you rather be a wildlife photographer than be a cardiac surgeon?
Given 100 times, I'll still do heart surgery. And during my heart surgery, we have been trained those days. This new knowledge. Those days, knowledge was not there. Nowadays, we are not allowed to do that kind of training anymore. We used to get trained around 36 to 40 hours continuously.
Oh.
Yeah, we'll be working from morning 6 o'clock till next day, evening 8 or 9 o'clock. Go home, sleep for 8 hours, 10 hours, come back and work. That time, this knowledge was not there. And we'll be got trained like that for 5 years. And if you ask that at the end of 36 hours, if you ask your name also, you will not know what your name is. That kind of exhaustion we went through. But having said that, given a choice, I'll do that again. Because that is my first and last love. And wildlife photography, my second love.
Okay. Thank you so much,
My
Doc,
pleasure,
for being
my
here.
pleasure.
All the
Yes,
best.
yes.
Thank you for watching or listening to this edition of the NI podcast with Smita Prakash. Do like or subscribe on whichever channel you have seen this or heard this. Namaste, Jai Hind. Click here to watch the previous episodes.